Well, good morning, everybody, or good afternoon, depending on where you're located.
Yes.
Michelle Brunson. Hi there.
Hi.
We are going to go ahead and get started. It looks like we've got some other people signed on, so I'm really excited about this call. This is a call that Telegen, we are trying this peer-to-peer learning out. We haven't done anything like this before. And so it's a good way, really, for all of you to connect with each other and ask questions of each other, find out advice, whatever different challenges you may face or how you perform and how you would like to improve on that. And so it's really meant to be pretty, or actually very interactive with each other. And so I'm looking at the attendee list, and it looks like we probably have right now maybe 9 people signed on. And I think that's a good number for us. I'd like to see if we could go around the room and talk, tell each other your name, where you're from, your practice size here. But before we do that, I just want to let you know we are recording this call, and so it will be posted to our website in the next few days under TelegenQPP.com. There's a drop-down for resources and then webinars, so it'll be recorded if you want to go back and listen or refer anybody to the call recording itself. And at the end, we'll ask you to complete a survey to see what you think of this. Like I said, this is brand new for Telegen to try something like this and have you all learn from each other. And we're pretty much just going to be facilitating the call and asking some questions to get conversation started. But by all means, please feel free to interject any questions, any feedback you might have, and really it's for you. And so we appreciate, again, your time today. And like the slide shows here, I have Tamika Williams. We work together. I work with small practices in Iowa, Nebraska, North and South Dakota, and Tamika works with part with our small practices, mainly in Nebraska, and then part with bigger practices of 16 or more clinicians in Illinois. But then Telegen also, we have the contract as well for Iowa and Colorado. So we have a nice mix of practices. I think you're going to see smaller and bigger, but all that use eClinicalWorks. So with that, I will just ask that if you wouldn't mind, when you're not talking, if you wouldn't mind putting yourself on mute, so that way in case you have background noise or whatever, we try and minimize that as much as possible. But like I said, this is all for you. So I'm going to go ahead and get started here, and we're just going to open this. Well, before we get started, I'd like to have you all go around. It looks like maybe we have 11 of you. And so just let us know your name and your practice name, if you would. And it looks like I'll start with maybe Michelle Smale.
Michelle Smale. I work for Uncomposited Medical Center. We use ECW, and I'm the QI coordinator here.
Thank you, Michelle. Welcome.
Thank you.
How about Melissa?
Melissa Rosine, Lincoln Surgical Group. I'm the Billing and Coding Manager.
Awesome. Thank you, Melissa. And Catherine Ellis?
I'm Catherine Ellis. I work for In-Home Medical Group as a Systems Integration Specialist.
Thank you, Catherine, and welcome. How about Jill?
I'm Jill Gansimer with Lincoln Surgical Group. We have 7 doctors, 1 mid-level, and we're a multi-specialty group.
Wonderful. Thank you, Jill. Elizabeth?
Hi, I'm Elizabeth Cathy. I work for Amita Presence Health, and I'm an account liaison, if you will, for our private practices that utilize eClinicalWorks. So I'm very interested to hear about the positive and challenges of practices. Many of ours are a bit on the smaller side, I would say.
Great. Well, thank you so much and welcome. Matter?
Hi, good morning. I'm with Presence Health Amita also. work on a number of practices that Lisa just talked about. So looking forward to the discussion.
Great, thank you. Thank you for joining. And then Obiageli, did I pronounce that right? Maybe we lost her. Ronalyn? We may have lost a couple. Maybe they'll jump back on here. Did I miss anybody?
Christy Spinuzzi.
Oh, Christy, hi. Thank you for joining back again. Great. And what's your practice name, Christy?
I'm with Parkview Medical Group, and I'm an RN Quality Data Abstractor for 252 physicians.
Wow. Okay. Wonderful. You can see the size differences here, but you all have one thing in common, and that's you all use eClinicalWorks. So with that, I'm going to go ahead and get started here. So what we're going to do is put up a polling question, and Tamika's going to help me with that part. And we'll have her open the poll for each question, so then we can talk about this. So the first question is, how long have you had your EHR? 1 to 2 years, 3 to 5, or 6 or more? Okay, with that, go ahead and close that poll. Tamika, if you wouldn't mind showing us those results.
Okay, I'll close it out. Are you able to see the results now?
Yes, thank you. And I didn't answer, and Tamika didn't answer, so it looks like 6 or more is the winner there, so that's great. We're going to have some good experience, but then also 3 to 5 and 1 to 2, so a nice mix. Thank you, Tamika. Okay, and then of those, how many of you know if you submitted, it used to be called Advancing Care Information category for last year, if you submitted your data last year? And I'll go ahead and let you open that poll up, Tamika. Just trying to get a feel for your background and what you did last year, what you plan to do this year to start off. Okay, go ahead and close that poll, Tamika. Great. Good. So we have 6 of you that know that you did, and 2 if you were unsure if you did. So this is perfect because even if you are unsure if you did submit that data, this is going to be very helpful for you to talk with others about what they did and how they did this. Okay, our third polling question, were you able to submit your own quality data, or did you have another submission mechanism? So what I mean by this is if eClinicalWorks can wrap up their data in a format that CMS required for you to submit your own data, it was called the QRDA3 file. And so if you were able to do that and did that, you can choose EHR. But otherwise, if you use another submission mechanism like the registry or qualified clinical data registry or claims, or if you were unsure, go ahead and let us know that.
What about going through QPP?
Yes, that's exactly right. So that would be the EHR method. If you were able to upload that file, much like you would upload a picture, going out there and choosing, it used to be called Advancing Care Information, and uploading that right on the QPP website. That allows you to be able to do that. So, Tamika, you can go ahead and close that poll. Okay, so we have a few of you that did submit your own. That's wonderful. One of you that used the registry, 1 for claims, and a couple that are insured. And this is really, I think, brings up a good point we want to talk about, that not many EHRs were able to allow you to submit your own data using that format that CMS requires, the QRDA3 format. And so it's really nice that eClinicalWorks allows you to do that. So of those of you who chose a registry, was it a registry that you were already enrolled in, so they said they would submit your data on your behalf? If you want to talk about that for a little bit.
Well, I mean, we use eCW to collect the data and we do a registry, but then I had to go through the QPP portal to submit all the information. So is that still through EHR or is that through a registry?
Most likely through the EHR then if you submitted. So when you went to the QPP portal, did you click on the Advancing Care Information button to, and then it said to upload a file, and did you click on that and go and find that file? Do you remember how you did that?
No, actually, Jacob at ECW sent the information for PMG.
Okay, awesome. And so for those of you that chose that method, did you all have eClinicalWorks submit your data for you?
I still had to go into the QPP portal and put in the denominators and the numerators and attest, yes, and things like that, but then they just sent the files for me.
Okay. So that brings up a good point here, and I apologize, I don't know names of who's speaking, so forgive me, but
I'm sorry.
Thank you. No, that's okay. No. So Christy, there were 3 different categories to submit data for the quality payment program last year, and so the quality category was the one that was weighted at 60%, and that is the one that CMS would not allow anyone to manually enter in, like the numerators and denominators.
Right, I did that.
Then the promoting interoperability, it used to be called Advancing Care Information. Mm-hmm. So that's where you maybe entered in the numerators and denominators and then said, yes, I'm not blocking any information, and you attest that you completed a security risk analysis.
Right.
So it's so confusing because it's nice that they allow the ability for you to submit your own data, but then you could also submit this quality data would have to have been submitted in one of these formats. But the EHR format, is, like I said, it's nice for the EHR to be able to roll up that data into a file that CMS needed to have you upload it onto their quality payment program portal, if that makes sense.
Yes, it does.
Good. How about the rest of you? Did anybody else who answered that they used the EHR, did you have eClinicalWorks submit it for you, or did you submit the QRDA3 file yourself? Well, we'll just go ahead and move forward then here. Okay. Now, like Christy was saying about the promoting interoperability, or it used to be called Advancing Care Information, do you plan on submitting your PI data this year? Or will you request a hardship exception if you are in a small practice, or maybe you have another extenuating circumstance for the promoting interoperability? And this used to be called Advancing Care Information last year. So it's where you're e-prescribing and you're sending a summary of care and providing patient education, those measures. So Tamika has opened up the poll, and we will go ahead and give that just another second. And Tamika, you can close that poll.
Okay, I'll close it out.
Okay, so 5 of you did submit data. A couple are going to, or you plan on submitting data. A couple of you will or have requested a hardship exception. So, and one is unsure of what they're going to do. So, with this ability to submit a hardship exception for those that are in small practices, that was new this year, and that's one of the reasons, but by no means is that the only reason. Like I said, there could be extenuating circumstances out of your control. You could have maybe your EHR is not certified anymore, something along those lines. If you choose to submit a hardship exception, and then you decide you know what, we are doing fairly well on this. I think we would like to try to submit data, and that's the category where you can manually enter in your own data on the QPP website once you have your Enterprise and Identity Management User ID and Password, or EIDM. You can still submit your PI data, and then if you do submit data, then they will just, your data will be scored, and they will not have the hardship exception be enforced then. So it's kind of nice if you feel like there might be something that's prohibiting you to do well in that category, or maybe your eClinicalWorks is charging for the Health Information Exchange module. I've heard of that from another EHR, and you don't have the funds to do that. You could choose that hardship exception. So I like seeing that we will have some people submitting data, though, this year, so that's great, because that's one of the benefits of the EHR. Okay. Now, in this category of promoting interoperability, one of the challenges that we have heard, and I think it's pretty common, but maybe not so much in the bigger practices, if you have been able to send your summary of care documents to other practices and or even, we'll say, receive summaries of care from other practices. So Tamika's going to open this up to say if you have or have not, or maybe just one or two, like you've tested the functionality, but you really haven't implemented this yet.
You mean like P2P referrals?
Yes, exactly. Thank you. Thank you. Okay. Tamika, why don't you go ahead and close that up and let us know if people have been able to do that. Okay, so one yes, a couple no, and one not many. So you can see that this is it's a problem, and I know we didn't get a lot of people answering on that. I'm not sure if we have everybody on the call or if they're not sure how to answer that. But the summary of care, or P2P, provider to provider, that is a great functionality that I think it will start taking hold here in the next year or so. There are some pieces that you need in place to be able to submit a summary of care, and first of all, that means that it's all information that's sent from your EHR to another provider, to their EHR, and they don't have to have eClinicalWorks, but you need to know your direct address. And that is just your secure email address from within eClinicalWorks. And they also need to know theirs. And so this is something that it will be replacing the fax machine. It'll be a lot easier, and of course it'll be secure, so you'll know who's getting that on the other end. And so we hope that, as people become aware of what this is, that you will call to those other practices and have somebody maybe you refer patients to certain practices, and you can start off small and call them to collect their addresses and give them yours, and then test that functionality out with them. It'll take a while. So they may need to contact their EHR vendor to find out what this is and how to get it. I've heard all across the board. So I'll open this up a little bit. Like I said, this is a facilitation call for you to all talk with each other, and you don't need to hear me speak about this. So those of you that have not been able to do that, or those of you who maybe didn't answer, you weren't sure, what have been some barriers that you've encountered?
Well, I'll go first. We just actually bought the EMR portion of the eClinical last August, so everything was thrown on us all at once. And so I actually just finished my spreadsheet for the addendum for the HISP for the direct messaging, and it is unbelievable how much work it is just to enter all that information, and I don't even have all of it that is needed. So I just sent that off. It's just been so time-consuming. So it's not a matter of, I don't think it's expensive, but it's just very time-consuming.
That's a great point. And now, how about any of you others? Do you have any tips or anything for her to, how did you get through that? I guess, is there anything that helped you expedite that a little bit, or is it just going to be a very manual process?
So this is Madhur with Presence Health. I think a couple of things. One is, I think the bar to this point has been low in terms of HIE. If I remember correctly, even sending one CCD document, would help you meet the base score in ACI. So that is not, tough to do.
Right.
I'm sure the threshold will increase over a period of time, and therefore we have to ramp up this capability for the practices. The second thing that we saw within the scoring itself is that even if they had not exchanged even a single document, they were still able to claim the exclusion of having less than 100 referrals.
That's right.
So they got away with that, using that exclusion, I think.
Yep. I agree, Matter. Thank you for that, because that's the other point, too, is that they have to even know how to indicate that a patient is a transition of care, because that is the denominator. And so you're exactly right. I worked with practices, I know that they sent patients to, specialists, and they wouldn't even have anything in their denominator. So what we talked about is you have to let these EHRs know that you have a transition of care. And if you don't do that, you won't have a denominator, and therefore then, even if you sent these summaries of care, it wouldn't matter because it's not going to show if you don't have a denominator. So that's the hard part. And maybe we can talk about, Matter, if you wouldn't mind, did you have any issues with knowing how to document the transition of care? And if you wouldn't mind just verbalizing that for the others in case there might be some people on the call that aren't sure of what this is or how to do that, if you do know that is.
I mean, I'm not totally sure, to be honest, and I can talk about our experience within, the Epic EMR. We have a wide variety of practices using all kinds of EMRs.
Sure.
And again, we're trying to get up to speed on our newly acquired practices, that, use ECW and what their experience is.
Yeah.
So that'll be new for us this year. We hadn't supported them in the past, but we did support Epic-based practices, and basically we relied on the system to do that. So any referral that happened within the EMR itself, I don't think we needed to do anything manually there. The EMR would record that within the denominator. But I can see how if you're doing it outside of the EMR, then I'm curious to find out myself how you have to do it manually. We haven't gotten to that point yet, I think. So.
This is Tamika. I have one tad bit about ECW. One of the good things I think about, or one of the positives about the system that I found with helping practices is that they have a very user-friendly customer portal. And inside of ECW's customer portal, you can find different workflows that will show you how to document and where to document these things in order to get credit. So if you're familiar or you have your customer portal login for their customer portal website, if you go to their knowledge base, you'll find videos and how-tos and workflows that will walk you through a lot of these requirements for MIPS.
That's awesome. Thank you, Tamika.
Thank you.
Great place to start. Yeah, because, you know, if we don't have a denominator, then we can't work on the numerator, and then they'll choose the exclusion, and we're really not using this functionality that it's like a lot of work in the beginning, but to get everything loaded and get all of that, the direct addresses and the workflows down, but then once it's there, it'll make it so much easier for people. So, thank you for that. Does anybody else have some other parts of discussion points that they would like to talk about? Not just with the summary of care documents or that measure in the promoting interoperability category, but anything with documenting or finding it difficult to document or some challenge that you're facing.
I think the hardest part about sending your P2P referrals is that there's like 6 or 7 documents that need to go with it.
Ooh.
Not just a matter of sending the progress note or the CCR. You have to make sure your meds are all updated and verified, that your allergies are updated and verified. You've got to attach your progress note. And you got to make sure your snow meds are mapped before you can even be eligible to send this. It'll send it without all those, without the 6 or 7 requirements, but then it doesn't count.
Okay. That's so helpful to hear that. So, what do the rest of you do? If you have somebody that, like, sends a summary of care, or is it supposed to be in your workflow with the nursing staff, or how does that work for all of you? I'm going to pick on Jill just because I know Jill. She's the one person here I do know, I think.
Hi, yeah, that's
Hi,
me.
Jill. How do you do this? I can't remember if you were able to choose an exclusion or how that worked.
You know, we have not been able to do that yet. I'm the one, I'm sorry, I should have introduced myself when I said I just got done doing the spreadsheet. I basically ran a report since we're a specialty office. You know, we get a lot of referrals. And so I ran a report and took the highest referral doctors, and I think there were almost 100 of those, and made a spreadsheet. So we're just in the baby steps of it.
Absolutely. And I think you're definitely not alone, Jill. So thank you for that. Sorry, the voice is hard for me.
I understand.
How about Catherine? Are you on, Catherine, from In-Home? I got that right? Just trying to see, like, what other people do, or if someone feels like they are further along. How about that? Does somebody feel like they understand this a little bit more? And if so, do you have any tips for any of us? Okay. Well, how about not necessarily this measure for promoting interoperability, but any other PI measure that's causing you trouble, or that you'd like some input on how others are doing? Okay, well, I won't bore you then if that's the case, but I'll just move to our next question, and we can then open it up for other discussion topics, of course. But the next question is, do you plan on completing an improvement activity using your certified EHR technology for the PI bonus? So as you may or may not know, by completing a CERT-eligible improvement activity, you may get 10 extra bonus points under the promoting interoperability category. So it's a nice, like, win-win if you've been able to choose one of those. And this year, there are 30 improvement activities that fall under that CERT included. And so I just want to, first of all, draw your attention to that if you aren't aware of that, and let you know that if you just complete one of those improvement activities, you get the full 10 points. So you can, of course, complete more than just one of those that count for the bonus, but even just one, they're allowing you to receive the full credit then for that PI bonus. So I'll go ahead and Tamika posted this if you want to answer, if you plan on doing, completing any of those improvement activities. And then we can talk about maybe which ones all of you are doing if you have thought that far ahead yet. Okay, Tamika, go ahead and close that poll. Let's see how everybody scored there, what they chose. Okay, so 2 of you said yes, you do plan, and 1 is unsure. If the 2 of you that did say you are planning on completing the improvement activity, would you mind volunteering if you do know? If you, that is if. You may not be certain if you're not the person in charge of the program, but letting us know which of those activities you were looking at.
Actually, this is Christy, and I'm with Part 2 Medical Group, and we actually got accepted into the study of the burdens associated with the MIPS dashboard, and so we'll be completing that study. We've completed Survey 1, and we are waiting for Survey 2 to come over, and so that's how we are going to meet that measure this year.
Isn't that wonderful? And good for you for being for getting accepted into that. I had a practice last year that was able to be a part of that study and get the credit for the improvement activity bonus or improvement activity category. Wonderful, Christy. Thank you.
Mm-hmm.
Was there another person that thought they were going to complete one of those eligible improvement activities?
Yeah, this is Madhur with Presence Health. I do not know off the top of my head, which one would fit that category, but
sure.
I can talk to what we did last year.
Yeah, sure.
We basically looked at the larger list of improvement activities. I think there are about 70 or some, or maybe more 90.
Yeah.
Close to 90 improvement activities.
90, yeah, I think 93 or something.
Yeah. Yeah, so we had we had those, and then we basically met internally between our IT team and our CMO to basically kind of walk through those and say which ones made sense and which one of those things are things that we can attest to, saying that we are in fact doing these improvement activities. So we basically narrowed down to 8 or so activities from the
that's
plus.
great.
And then we basically communicated to the independent practices, small practices that we work with, to say, you're obviously, free to attest to any improvement activities available to you, but we feel based on review that, these are the things that you can comfortably attest to and stand behind them. So we gave them a list of 8 or so activities. And I do know that some of them did qualify for the bonus. I'm not remembering exactly which one of those are at this time, but I do remember some of them meeting that category.
That's great. Thank you, Madhur. And I know one of them that I seem to have a lot of clients using that did have an EHR that is a high-weighted activity. So for those of you in small practice, that would be all you would need to complete, but those of you in a bigger practice, it would be half of what you needed to complete, is that providing 24/7 access with those providers that have real-time access from your EHR. And so the document, and you may all know about this, but I just like to give it a plug that CMS has on their resources page, is the MIPS data validation criteria document. And it basically is for each category the suggested documentation that you need for the improvement activities, and then also going through the measures and what they're requiring for each one of those categories. But truthfully, I use it just for that suggested documentation for improvement activities, because that way you have an idea of what they're looking for. And so I have on the last slide there resources, and there's the links for the CMS resources page. I just really can't stress enough. They do a great job. CMS has posted a lot of resources out there to try and help. And if you're working with an advisor, then we can bring those resources up and show them to you as they might be pertinent to whatever we're discussing. But please don't shy away from that, because they really try to make those resources in language that's easy to understand. But one of those that suggested documentation is called MIPS data validation criteria for these improvement activities. And so with that 24/7 access, then you would need like a patient chart or a patient record from your EHR that's time and date stamped showing that the record was accessed outside of normal business hours. So it's pretty easy, and because we all have EHRs with eClinicalWorks here, then that might be something you would want to consider. And of course, please don't, we're going to have our contact information, so please contact either myself or Tamika afterwards if you need anything with that or anything else here. That's really what we want to stress enough. Now that is the end of my polling questions per se, but now I'd like to open it up, and first of all, Tamika, if you can think of something else that came up that you might want to talk about for discussion topics, but then I'll just open up the floor to anybody that might like to ask questions of something specific.
Thanks, Michelle, for the polling question. I think it was very helpful to get an idea of where everyone falls. One thing I think we should maybe bring up is the patient portal. Maybe if there are people on the phone that want to talk about how they're doing in that patient portal measure, any best practices they have for getting patients enrolled or sign up for the patient portal or anything like that.
Great, Tamika. Yes. Matter, do you know how you're doing with that measure? I'll start with you, if you don't mind. Don't mean to pick on you or anything.
No, I'm sorry. I lost track. Which measure are we talking about, please?
The patient portal providing patient access, and then once they have access, another measure would be view, download, or transmit, like they're actually going out there to their portal and looking at their information, as well as secure messaging. Thank you.
Yeah, absolutely. Again, I'm learning, or we need to learn about our ECW practices. We are just in the very early stages of that, but I can certainly talk to our experience with a lot of our other practices who are on Epic. We do have, a very good portal, patient portal, that the patients can sign up for and access, and we had basically rolled out a marketing campaign to increase adoption and sign up, especially. There are a lot of things we did push out to have more sign-ups with patients, at any of their office visits or discharges from hospitals, things like that. So there was an active campaign to increase that. And then in terms of secure messaging, also there were a couple of initiatives at least to increase that, the score on that measure too, basically centered around, broad activities that apply to a lot of people. So if they, basically tying it to after visit summaries. So anytime they completed an office visit or were discharged from the hospital, they would get a message, a secure message, related to their diagnosis or after visit instructions. So those are the kinds of things we are doing to do better on those measures.
Those are great ideas, because I really do think it is a complete team effort. Those of my practices that have scored very well on at least providing patient access, and now they're starting to score well in the view, download, transmit. And secure messaging has always been kind of further behind, but they allow practices to, for the secure messaging, just as you said, to send that document of the patient visit. And so not only does it recap everything for those patients that maybe weren't able to bring a loved one with, or they couldn't remember something that happened during the visit, so they can see that as well as going out there, so they're getting the view, download, transmit by looking at the summary of the visit, and then maybe asking a question. So great ideas. And how about your campaign for getting patients to sign up for the portal? Was there anything you found to be more helpful or get more attention than another? Or do you know that maybe even being the case?
Yeah, I think we, looked at best practices, that, maybe some others within our EHR community did. And this was all focused around eliminating barriers to the sign-up process and making it easier. I do not know the specifics very well, but the general idea was that, they didn't have to go through an elaborate sign-up process and things like that. At the time of them completing their office visit, they would be given a code, a key or something that they can, use to positively identify themselves and go to the website and sign up themselves. They didn't have to necessarily pick up the phone, call a number, and then identify themselves and complete the setup process. So I think that's an example of eliminating barriers and things like that. So
that's great. And how many?
I'm sorry, Michelle, go ahead.
Go ahead, Tamika.
I was just asking, our cell phones are becoming so big now, and for us getting information and communicating with people. I'm just wondering if anyone has heard of, patients leaning towards downloading the apps I think we talked about ECW has the Healer app, and so there are different apps now that go along with your EHR so that you can communicate with your providers. Any of you have heard about patients using the app, and maybe that's a way of increasing those numbers as well, promoting that app?
Yeah, absolutely. I mean, we've seen that help with adoption and sign-up process as well as continued engagement. On the Epic side, I know they use MyChart app, so I think that's driving up users logging in and using it more. So I think that definitely helps.
You've been so helpful with your input, Matter. Thank you so much. How about any others on the call? Do you have any strategies that you've implemented?
This is Lisa, Kathy. I'm actually more curious as to some of the smaller practices and how much support you get through your ECW support, or does it take a group like this? I know there's a lot of support structures for EMRs are sometimes different. So hearing, that the HISP addendum was so time-consuming, what additional support do you get either from ECW directly or from your services like this through Telligent?
Thank you, Lisa.
Well, this is Jill, and I'll just go ahead and speak up since nobody else is saying anything about it. I will take my turn and say that we have really struggled in our practice here. We have 7 physicians in one mid-level and a surgical multi-specialty. And so it just seems very difficult at times to get help from eClinical, period. I think that we had just massive issues with our eClinical mobile dictation when we first started up, and so that took up almost more than half of a year just trying to get that going. So I think that I should have, in hindsight, looked at Telegen as a resource for me. However, recently, Michelle's been wonderful for me, so I'm hoping that we can keep that relationship strong and she can help us to be successful yet this year. But we're just basically on bare bones. Just we don't have IT consulting people or managers. You know, I'm the practice manager, but we also have a billing manager, and we're basically in charge of setting up everything, figuring everything out, solving all the problems, plus doing our own jobs. So it's been very difficult for us here in Lincoln.
Well, thank you, Jill, for speaking up.
Yeah.
And, of course, I'm here for you, and that's wonderful. That's the best part of my work that I do. So thank you so much. How about somebody else? Is it Catherine? Or maybe Michelle?
Well, this is Elizabeth again. Thank you for the feedback. And if you don't want to speak up, that's fine. I think because we're expanding and trying to understand the challenges, I really appreciate that feedback. Thank you.
Oh, sure, anytime.
I can tell you what we did at Parkview to try to help with our secure messaging is anytime a patient sent a message through the portal to one of our providers, our MA that sends out the messages in the morning after she collects them all, she sends a reply back to them that says, thank you for messaging us through the portal. Your provider will get back to you as soon as possible. So that right there replies to the message, and so that does meet the measure.
Yeah, and while we're on the phone here, this is Jill again. I'm looking under the patient portal settings, and I look under the administration dashboard, and there's it comes up with this great report of graphs that says, you know, your access statistics and your portal usage trends, the number of requests that have been coming in, what they're looking at. So this is something I just found today, so this is exciting.
Oh, good. See, that's what this was meant to do, that's for sure. How about any others on the call? Virginia? Oh, well, that's helpful. So thank you to all of you. Now, I will just, I guess, I don't want to keep you unnecessarily, but if anybody has any other questions, comments, suggestions, or challenges, anything you'd like to share?
So no one really talked about their dashboards. This is Tamika again. So I'm just curious if those that are using ECW, do they use their dashboards to track their progress throughout the year, or how are they utilizing the dashboards? Are they running the reports and giving them to their clinicians so they can see their progress, and how are they gauging that and improving it?
Wonderful. Thank you, Tamika.
This is Jill again, and I don't even know what that is. Dashboard, whatever it is. So
you should have report reads access to your dashboard through your ECW report tab.
Okay.
Up at the top of the screen, and you go into reports and report console, and you drop that down to MIPS, and you'll get access to your dashboard. Every provider has free access to their dashboard. If you're not paying ECW to manage your dashboard and collect your data, then of course you won't be able to see anything but your score.
Okay.
So Jill, you and I will, we need to get an appointment so we can go over that dashboard, because it really is great to see. And as we know, we're just starting that fourth quarter, and so the PI category, the minimum amount of time that you can submit data is 90 days. And so, you know, we're like just in the last part of it now. And one of the biggest pieces of the PI category is, I think anyway, that can be more time-consuming is the completion of your security risk assessment and, updating your policies and procedures if there's a deficiency, fixing that. So that's a big piece that oftentimes people don't think about right away, but at least in those first year or two, I think it takes a while to complete that, and then updating it and anything that changes is a lot easier down the road. But so you and I need to connect on that then. We'll set up a time here to go through that. But yeah, the dashboard is awesome. It's a great way to get a snapshot of how you're doing and then go back, as Tamika said, to providers. How about the rest of you? You may have had people drop off too. That's a great question. And anything else then?
Just one last thing I'll say, Michelle, Tamika. Just so everyone is aware, I think today's October 3rd, so this is like the last data. If you want to report 90-day period, today is the day to begin doing that.
Yes, and not just for the high category, but also for the improvement activities. And so it's a little plug for you to go ahead and contact us. I have just a couple different resources there, but then here's Tamika contact information, my contact information. Please give us a call, send us an email. We'd be more than happy to help you and get you on the right path, making sure you're where you need to be right now to really make the most of the last 90 days here. And then also look at your other categories with you, namely the quality category, because that is weighted at 50% for this year at a minimum, if not more, depending on if you choose a hardship exception application or not. So I will ask one question. If you, we may have had people drop off, but would you want to share your contact information with each other? Do you think that would be helpful? Or do you have a pretty good contact with eClinicalWorks? I heard Jill does that with the small practices, but I didn't know if that was of interest to anybody. Well, maybe not, and that's just fine. We've had a couple other calls like this, and one of them they all wanted to, and the other one was pretty silent. So that's really what this is, and we're just trying to figure all of this out and see if this has been beneficial. If you wouldn't mind, after you hang up, go ahead and complete just as a short survey, just to let us know what we can do differently, if you found this helpful, or if you'd rather try suggesting something else that might be helpful for you either now or in the future. So thank you to everybody for attending, and I appreciate the input, and keep doing the work that you're doing, and we hope to talk with you soon.